now I'm going to discuss cervical cancer. This cancer is in regards to the cervix, which is the structure of the female reproductive system. What are some of the symptoms involved with cervical cancer? Well, what's unique and concerning of this cancer is there really aren't any symptoms at the early stages. That's why getting early screening through a Pap smear is so critically important to prevent any onset of this cancer. But if cervical cancer does develop, some of the symptoms that you do see are unusual vaginal bleeding or discharge, especially in between periods, vaginal bleeding during intercourse. And if you see any of these signs or symptoms, it's really critically important that you see your clinician as soon as possible. So what are some of the risk factors involved for developing cervical cancer? One of the most significant is the human papillomavirus, HPV, which is contracted through sexual intercourse and sexual activity. More sexual partners increases your risk for contracting this virus. If you contract the virus at a younger age, you have a much greater chance of actually clearing the virus. But as you age, your risk factor goes up, especially with increased sexual activity with more partners. So that's why it's really important for screening through the Pap smear and with the co-testing of looking for the presence of the HPV virus. Some other factors include a family history of cervical cancer, dietary habits, weight, use of oral contraceptives, and other sexually transmitted infections such as chlamydia. So how do we reduce the risk for cervical cancer? One of the ways is through HPV vaccines for the human papillomavirus. One of the names of the vaccines is called Gardasil. And what's unique about these vaccines is that they target many of the different forms of HPV, but most significantly HPV 16 and 18, which are noted as being the most virulent forms of HPV and contribute to about 70% of all the cervical cancer cases. And then the other way of preventing cervical cancer is going to be through your routine screening with Pap smear and co-testing for the HPV virus. Cervical cancer screening is important in women ages 21 and older. That's why it's important to do regular exams with the Pap smear and the co-testing. It's also important for women who've had prior hysterectomies, whether it was a full hysterectomy or partial hysterectomy, because they can still develop cervical cancer. And again, as women age, their risk factors for developing cervical cancer increases. Women can start screening at age 21. Between the ages of 21 and 30, a Pap smear should be done every 3 years. Once a woman has reached the age of 30, it can be done every 5 years, but even 3 years still at that point. As a woman reaches age 30, a Pap smear will be done, with the co-testing with the HPV, and that's done every 5 years. And this is continued on until age 65. Those are the recommendations. However, depending on health history and risk factors, screening and detection can go on beyond 65 years old. So depending on the results of the Pap smear and if HPV co-testing was done or not, your clinician will review these results and determine what further testing may be needed or not. That's why it's important to follow up with your clinician so that they can provide you with the proper timelines for necessary further testing, where, what, and when, or if everything's negative, when the next follow-up would be to repeat the Pap smear and HPV test. Should the chance happen where cervical cancer is detected, your clinician will direct you to services for treatment of cervical cancer. This can be done for various procedures such as the LEAP procedure, cryotherapy, conization of the cervical cells. Those are some of the ways of treating cancer or cervical cancer, and of course all the regular follow-up and care that's recommended by your clinician from there. Well, a Pap smear and an HPV co-testing are significantly beneficial to preventing and screening for cervical cancer. They're not always entirely accurate. But what's important is that you do the regular screenings at 3 or 5 year intervals as directed by your clinician.
I am Dr. Pam Forrest. I work for the Nevada State Immunization Program, and I'd like to talk about HPV vaccine. HPV vaccine was first licensed in 2006. HPV vaccine is an anti-cancer vaccine. It prevents cervical cancer. It has been shown to be safe and highly effective at preventing cervical dysplasias. The Advisory Committee on Immunization Practices recommends that the HPV vaccine be started sometime between the age of 11 and 12. It is advisable for both boys and girls to complete the series. If the series is not started at ages 11 or 12, it can be started for girls from ages 13 through 26 and for boys ages 13 through 21. HPV vaccine is administered on a 3-dose schedule. The first dose is given, followed by the second dose 2 months later, and then the final dose 6 months after the first dose was given. If for some reason the vaccine schedule is interrupted, there is no need to start over again. The vaccine administration just resumes where it left off.
For further information and data related to cervical cancer, please consult the PDF for Cervical and Breast Cancer Toolkit.